subjects have slightly over 50% of content is actually nutritional medicine. When I'm talking about modality, so the other half of that is basically Western herbal medicine. So nutritional medicine is a very, very significant component of what we do as naturopaths. And certainly, what we've also seen in more recent times, we've actually seen, and sadly in some respects, we've actually seen a decreased in interest in students actually undertaking a Bachelor of Health Science in Western Herbal Medicine, and at the same time we've seen this increase in students wanting to do bachelor qualifications in nutritional medicine. So often when we talk about naturopathy, we often pair naturopathy and Western herbal medicine. So sometimes, and no one talked about that tonight in terms of the herbalist side of things, but often they pair up. Now, we talked about tonight as well that in terms of being unregistered, any person can call themselves anything. So anyone can say they're a nutritionist, anyone can say they're a naturopath, anyone can say they're a natural therapist or herbalist. But even in our profession, we have interchangeability of names. There are people with herbal medicine qualifications referring themselves as naturopaths, with people with nutritional medicine qualifications referring themselves to naturopaths, and naturopaths referring themselves to as nutritionists and herbalists as well, despite the award that they've actually been given. So, do you see where I'm coming from? So, as John said, AHPRA is anyone that, when there's any ingested medicines involved, so when you're talking about biologically active complementary medicine, so nutrients, herbs and so forth, in the wrong hands they can be a problem. So therefore we do need to make sure, so therefore they can cause harm. So registration is important in that regard. But I would like to suggest that holistic nutritional medicine, and basically what we teach students where I work and essentially in other institutions that actually focus on nutritional medicine, it is a holistic qualification. It is embedded in something different. It is a natural therapies, complementary medicine side of things. It is different to what you may learn in another type of environment. And people will choose to come and see a nutritionist, that practices, in natural therapies, as they will continue to choose to see naturopaths. And that choice will always remain. If we become registered, we're not going to lose our unique ability in practice. We will absolutely attain that because we do have the philosophy, but we also have a different way of looking at things. And the different way of looking at things, I think, will remain. And also, it gives us, people will still continue to choose that. And so, what I see in the future is an expanded healthcare model where where multidisciplinary teams can get together and we all work together in a really harmonious and collaborative way to improve population health for all Australians. And I think that nutritional medicine, Western herbalists and naturopaths should really come together in a really cooperative and logical way, and united front to actually move our industry forward, our profession forward, our profession forward in a really, really positive and cohesive way. Now, interestingly, I would argue, because we know in terms of integrated medicine is becoming more popular in Australia, and certainly we know that a lot of general practitioners and other allied health and complementary and other medical practitioners use nutritionals, nutraceuticals, herbal medicines in their clinical practice. Why? Because there's a good level of scientific evidence, there's good clinical experience, and there's valuable therapeutic outcomes for their students. For their patients. Oh my goodness, that's a Freudian slip. For their patients. And so that's, so it's valuable. And in some ways, the nutritional medicine side of things, for the friends of science and others, are maybe somewhat more acceptable, because we know there's loads of evidence on dietary approaches for prevention and management. We know that there's lots of and increasing nutrients and even whole practice research and different lifestyle programs that actually improve disease outcomes. So it's nutritional medicine as part of naturopathic medicine is a really, really valid and really, really useful modality. Now, I will look at my notes, and I haven't looked at them at all, but here we go. So I just wanted to talk about, what I need to talk about that. And one thing I do want to say in terms of whether or not, I think to some extent historically, it's thought that nutritional medicine, clinical nutritional medicine, doesn't require to be registered because there isn't any harm. We've already talked about the fact that ingested medicines can cause harm. But the other thing is that even a workforce survey that was done in 2004 by Ben Susan and Myers basically said that, okay, I'll just read this to you here, the data for the workforce survey in 2004 suggests that naturopaths and Western herbal medicine practitioners will experience adverse events every 11 months of full-time practice, with 2.3 adverse events every 1,000 consultations. The adverse events from nutritional medicine were approximately half of that herbal medicine, but still representing a prominent number that requires attention. Additionally, there's a large number of food, drug and nutrient interactions, an ageing population, widespread polypharmacy in this group. There's an increased risk of adverse events as well, again emphasising the importance of accountability and responsibility in the provision of healthcare. And last, in this particular moment, in this particular idea, so this is largely driven by nutraceutical manufacturers. Not only is there an increase in the number of products available to us, there certainly is, we also have a lot of new and novel delivery systems enhancing bioavailability and metabolism. And therefore, the potential risk of adverse reactions for nutritional medicine products is probably going to increase. Yeah? Supporting the need for improved regulation. I'm just talking about, NT, HF, supplementation and so forth. Not proven yet, but there's novel delivery systems increasing systemic bioavailability, and the chance of adverse events or drug-nutrient interactions is probably going to increase. So we need registration as well, in my view. So the other part that I just wanted to mention, and how am I going with time?
About 2 minutes.
Okay, 2 minutes. We always ask about 8 minutes. We're quite good, aren't we? Okay. So the face of the natural therapies workforce, and as I mentioned before, so what we actually have, we've actually a decrease in young people wanting to do Western herbal medicine as a single degree. Good enrolments and increasing satisfaction with naturopathy, and those enrolments continue, and that's fantastic. And we've got this increase in nutritional medicine, and there's almost an equivalence now in terms of students that want to enrol in nutritional medicine and want to enrol in naturopathy. So what we are facing is a change in the natural therapies workforce. And we need to be adaptive, open and inclusive, in my view, in order so that we can actually be a united front and work together to offer really valuable and effective solutions for disease prevention, particularly because they've got this burgeoning economic healthcare costs with this ageing population. We are going to be very important. Exactly. We are already very important. But what we provide is really important, and I think it will continue to get attention. And I think if we work together as a collective, I think we'll achieve great things. So I think we need to think about how we can come together as naturopaths, herbalists and nutritionists. And look, as John said with Arona, these things necessarily aren't straightforward. And we don't certainly have the solution for that right now. But it's something that I think we need to think about. And it's something that I certainly wish to think about because I think it's important. So if we place the health of our nation first, the only option is for registration of naturopathy, Western herbal medicine and holistic nutrition practice so that we can truly offer integrated healthcare, efficacious, safe and ethical therapies. Let's stick together. Thank you very much.
Okay, we've got a question there. Thank you very much, Sandy, for the theme of unity in terms of our professions, nutritionists and naturopaths being together. And I think that's really important. So, quick question down here.
So nutritional medicine practitioners aren't covered by private health funds. How would registration change that?
Well, it'd probably improve that, which would be very good. I imagine if that were the case, and if that was actually achieved, that would be, I would think that there would probably be, covered by private health funds, as naturopathy is. I imagine. I'm not an expert on that, and I'll let John talk to that if he wishes to. But I will talk to one of the questions that you said before, or a little bit, is the fact that the standards of education are very important. And so for nutritional medicine, so students with Bachelor of Health Science and Nutritional Medicine, there needs to be a standard of nutritional medicine qualification and practice and philosophy that stands up next to naturopathy and Western herbal medicine for that to happen. So short courses and those sorts of things aren't going to be in that situation. I'll just talk to one other thing. All 3-year nutritional science degrees in Australian universities are non-clinical. So the clinical nutritional medicine degrees in complementary medicine colleges or natural therapy colleges are clinical-based degrees, and that's a very, very significant distinction because it's basically about practice.
So there's no student clinic component in a university nutrition or food science degree, while of course at the Naturopath College.
In a 3-year nutrition science degree, yeah. Thank you very much.
So one question, do we, or any nutritionists? Yeah, John's
This is just an extension of what I was saying before, that nutrition is a very, very new profession in Australia, and it's not a recognised profession, not because people don't want to recognise it, but because it is so new.
Yeah.
So Western herbal medicine was around for 100 years, nutrition is less than 10 years old.
Yeah, absolutely, and that's true, and it is very new, and I think that it has really taken off, and we weren't certain that was going to happen, and it really has, and therefore we have to think about it. Yeah, thanks, John.
Any questions from nutritionists in the room or nutrition students? Yep, just over there. Awesome. Thank you very much. Just for the speakers, the camera.
Yeah.
Thanks.
I'm actually a naturopathy student.
Okay. Yep.
But I'm just not clear on whether we think for ourselves nutritionists as well or not.
Well, exactly. That's the confusion. So you will graduate with a Bachelor of Health Science in Naturopathy, and if we go through registration, we protect the word naturopath, and that's what Kate was talking to, and that's what we honour. That's what you are. Yeah? Does that make sense?
But there's nothing that legally would stop you from calling yourself nutritionist now.
Yeah,
No, that's right.
Yeah, and I guess
Yeah, that's right.
Part of the question is what's different. We just need one extra year. So are they being significantly more so that we can definitely call ourselves nutritionists?
I'm sorry, I didn't actually hear. I didn't ever hear it all of that. Did you repeat? Sorry.
So, Dave, do you mind just saying that really loud?
Well,
just a bit louder.
Basically, we do the same sort of coursework, don't we? And then 1 more year is essentially our herbs. So what's the difference and why couldn't we?
Yeah. So they're essentially doing a naturopathy degree, still doing lots of nutrition, as you said.
Yeah,
so
absolutely.
shouldn't they therefore be able to call themselves a nutritionist and a naturopath?
Well, certainly, as Kate said, at the moment you can, and obviously people do.
But if I went, like, because I'm going to practice next year, so if I do that, then we get registered and then all of a sudden I'm a nutritionist, sort my title. It's more about whether that's sort of my thinking.
So the way the protection of title works is calling yourself something and saying that you practice something are very, very different. So acupuncture is a really good example. Any naturopath who's got training here can practice acupuncture with impunity. I wouldn't say impunity, but they are allowed to practice acupuncture. They're not allowed to call themselves an acupuncturist, provided you're trained in acupuncture, of course. You don't have to be registered as a Chinese medicine practitioner or an acupuncturist to do that. So the title itself is usually protected. Nutrition is not a protected title at the moment. So like naturopath, it's open slather. So at the moment, there's really nothing protecting either title.
Thanks, John. Thank you very much.
Thank you, Sandy. And we've got Stephen Myers now to give us some of his insights and knowledge as well. So thanks, Stephen. And of course, if you wouldn't mind maybe addressing the topic of the path towards registration.
Great, thanks, Max. And it's great to see such a turnout come to an event like this. I think these are important opportunities for us to actually, have what are critical discussions for our professions. I think the thing that I'd like to start off first is to just acknowledge that I started studying naturopathic medicine in 1979. I graduated in 1982 and I've been a professional naturopath now for 34 years. So there's a lot of history that has actually happened in this country over this period of time, much of which I think for some of you is completely unknown. For some of you, you won't be aware that there was a review of naturopathy and Western herbal medicine conducted by the Victorian government, which produced a report in 2005. So that was 11 years ago. You can find that report still online. I just looked at it on my smartphone. If you type in the word, you go to Dr. Google, you type in the word naturopathy, La Trobe, as in La Trobe University report, the first thing that's still coming up is the PDF of that report. That report is the basis on which naturopathy will be actually become a regulated profession. It was commissioned by the Victorian Department of Human Services, Health and Human Services, to look at the question of whether naturopathy and Western herbal medicine should become registered professions, to be done at the standard that was required by the body that predated AHPRA, and answered those questions, I think, extremely rigorously and completely, and came to a very succinct conclusion that naturopathy and Western herbal medicine should be occupationally regulated professions. Now, the primary reason that the group which I was honoured to be part of came to that conclusion was not because it will make the job of being a naturopath or a Western herbal medicine practitioner easier or more fulfilling, or make the profession more integrated into the wider health community, which I believe all of those things will happen. The primary driver was public safety, public health. I mean, interestingly enough, in this country, we do believe in a free market, and the whole concept of professional regulation actually goes against the principle of open competition. Regulation is actually anti-competitive. It's actually saying, I'm qualified to practice and you're not qualified to practice. Therefore, I can actually go into the marketplace and call myself a naturopath, and because you're not qualified, you can't do that. So it's anti-competitive. And to be able to pass the test of why a government that believes in free competition and open markets should actually impose an anti-competitive restriction favouring a group of people, the primary driver for that was public health and safety. And I think a number of the speakers before me, I know that both John and Sandy have communicated that basically, if you take away people, remember there was a wonderful Yes Minister episode that actually suggested the most functioning hospital was one that didn't have any patients. So if you take away patients and you didn't give anything to anybody or talk to them about anything, then we would be utterly safe. The minute that we actually engage people, particularly in a prime contact, off the street capacity, and we provide them advice about their health care, let alone prescribe anything to them, we have to face the test of is what we are doing in that capacity appropriate and safe and in the public interest. And that's the reason that the regulatory review of naturopathy and Western herbal medicine, and the actual document was called The Practice and Regulatory Requirements of Naturopathy and Western Herbal Medicine. That's the reason that that review suggested, yes, the criterion that was set at that particular point in time were met, and these professions should be occupationally regulated. It was only a quirk of fate that we weren't. If we had have given John the podium for the evening, he would have actually covered this, I think, in great detail. It was only the fact that we only gave him 10 minutes to speak that he didn't point out. It was only the fact that AHPRA was mooted, that the Victorian government didn't move to actually occupationally regulate naturopaths like they did traditional Chinese medicine practitioners, and this whole discussion wouldn't be happening tonight because we would be an occupationally regulated profession. So it was a twist of fate. I want to go back and touch upon a number of things that my colleagues have introduced just to provide some additional context to them. The one difference between the United States, where Kate trained, and Australia, where I trained, I went to the Southern School of Natural Therapies in Melbourne. I did a 4-year program that was available in the 1970s in Australia, is the fact that in the US they had to fight for the right to practice. They basically, you've all been brought up, I'm sure, on some American TV that, that without a medical degree, you have no right to practice in the United States. So our American naturopathic colleagues had to actually fight for the very right of their own existence. And one of the things that they fought in regard to that was to be equal to general practitioners in the community, and they won that battle in a number of states. And the degree that Kate has, as she pointed out, is as a naturopathic physician. In Australia, we practice under British common law. Interestingly enough, in 1412, they passed the first medical act that made it illegal to practice physics or surgery without a medical degree, unless given permission by the Archbishop of the diocese. I love that let-out clause. Very shortly after that, so 1412, 1432, 20 years later, they passed the Herbalist Charter under Henry VIII that basically gave anyone who had knowledge of herbs and healing waters the right to practice in the King's dominion for hereafter. And that's something that's deeply embedded into British common law, which we inherited as a British colony. And so we have this right to practice in our community that's part of our British heritage. And that's one of the fundamental differences. We didn't have to fight for the right to practice. One of the things that we're actually fighting for is to actually be recognised as a fully engaged, fully qualified primary healthcare profession. In the La Trobe report, we actually recommended that we follow the Australian model, which is for regulation of title. And one of the things that we did was we made a great grab for every title that we could think of that had naturopathy in it. So we recommended naturopathic physician, we recommended naturopath, we recommended naturopathic doctor. We recommended basically every title that we felt appropriate to ensure that the profession was actually captured. The critical thing about regulation is education. One of the things that it sets is a minimum standard of education and an appropriate professional set of standards for practice. Part of that is ongoing professional education. And one of the things that I actually think is an important component of occupational regulation is the capacity to penalise somebody and say, you no longer have the right to use the title naturopath. Interestingly enough, John pointed out to me the recent case of somebody claiming to be a naturopath who was engaged in a situation that's in court at the moment, was somebody who in 1998 was also implicated in the death of a patient. At no stage did somebody say, you no longer have the right to call yourself a naturopath. I went to their website today, they're still calling themselves a naturopath. We've got many cases of people without appropriate educational qualifications using the title. So if you're studying naturopathy, you can actually call yourself whatever you like at the moment, but one of the things that we need to be aware of is that anyone can call themselves a naturopath. One of the things that happened during the Latrobe report, which was very disheartening, was the fact that one of the members of the Australian Skeptics Society was able to join one of the professional associations for his dog, who he actually did an online naturopathy program. So we've got a crazy situation where anyone can call themselves a naturopath. Even those of us who've actually worked hard to train to be able to get that title, we aren't at the moment appropriately differentiated in the community. I think there's a double standard taking place, something that I'm hoping to address in a paper that I'm working on at the moment. But in the NHMRC report, and I'm looking forward, John, to reading your review of it, they basically only accepted evidence for the practice of naturopathy, of which we don't have a lot, and a lot of it's based in North America. But when I actually pick up the Medical Journal of Australia, they accept as evidence for medicine whatever the latest drug trial is or whatever the latest surgical finding is. One of the things in the Latrobe report, we looked at the benefits of naturopathy, and we noted that there was not a lot about the practice of naturopathy, but there is an immense amount of knowledge about our tools of trade. And we did a review of our tools of trade and demonstrated, just looking at systematic reviews across 5 years, that we had tools that were clinically proven to be effective in every major body system for every major clinical condition that people were likely to actually see. And therefore, if our tools of trade are effective, the likely benefits of our practice is also likely to be effective. One of the things that I'd just like to note in ending, it's an interesting thing that we're having these meetings in sort of windowless rooms. We're part of an unseen, hidden component of the healthcare workforce, unacknowledged and unseen and totally unrepresented. Yet we probably actually represent a very large proportion of healthcare consultations on a day-to-day basis. If we take our complementary medicine brethren in chiropractic, in osteopathy, in acupuncture, in traditional Chinese medicine, we put nutrition, we put herbal medicine, we put naturopathy, we probably make up 20 to 25% of healthcare consultations in this country at a relatively conservative estimate. If every one of those people stopped practicing today, I'm not sure that our healthcare system would actually withstand the quake that would occur because at the moment we're propping it up. It's high time that we're not only occupationally regulated, but we're recognised for the role that we actually play in Australian healthcare provision today. Thank you.
Stephen, that's excellent.
Can I answer the question that the woman asked before, which I didn't actually get to?
Yes.
Colleges. Why are colleges not engage with each other? It's a really interesting question, and one of the problems associated, I think, with the fact that currently the custodians of naturopathic, nutritional, Western herbal medicine education are in the private sector. I think there was great benefit when we had some providers in the university sector, because the university actually realises that as a profession we've got to actually embrace who we are and research who we are. I've had doctoral students that have been refused access to private colleges to ask students questions about their education. That's not a educationally progressive interaction. 15 years ago at Southern Cross, we had the audacity to invite nutrition lecturers from all the private colleges in Australia to come to Byron Bay. We paid for the accommodation, we paid for the food, and we actually asked them to come and attend a 2-day professional gathering. And a lot of people turned up thinking that our agenda was that at Southern Cross University we wanted to actually take over nutritional education. They were very surprised to find that what we did on day one was we said, this is the first time in this country 40 lecturers in nutrition from private colleges and university providers have got together. What do you want to talk about? And after the sort of shock of a lot of people who were there really to confront us, we actually discussed everything from curriculum to assessment. We did a second meeting and developed a definition of naturopathic nutrition. It was so successful we did the same thing in herbal medicine. We got 40 lecturers teaching herbal medicine together to actually just have an educational forum for lecturers in herbal medicine in naturopathic education. And I think it's a great indictment that 15 years has gone by and no one has actually gathered the profession together of educators in any way to create collaborative interaction. And that to me is one of the problems associated with private provider education, is that quite often it's where the dollar sign will extend and it doesn't actually look to the future in terms of how can we actually develop a broader profession. There needs to be more digitation between colleges so that we can actually make sure that we are teaching to similar standards, that our assessments are of similar sort of quality, that there should be an exchange of ideas and information. And I completely agree with John that it's absolutely imperative that colleges maintain their own individualistic flavour and flair. But I think we've got to the point in our profession that there actually needs to be a lot more dialogue between educators and that we shouldn't be representing just individual silos any longer.
Thank you. So we've got a question down here.
Protection of title. Why do you think this is necessary in naturopaths, considering that dietitians are members inherited and however they do enjoy protection of title as recognised professionals? They aren't accredited, are simply accredited members of the Dietitians Association of Australia. So how does that work?
Well, firstly, as John pointed out, we're in a great situation in this country where the legislation that protects professions is based on the concept of protection of title as opposed to protection of practice. So even medicine is based on the protection of title, being a medical doctor or a medical practitioner. A lot of people within the complementary medicines professions, to make it absolutely clear to people, even have on their business cards not a medical practitioner, to actually ensure that people don't mistake their title inappropriately. Literally, in terms of why I think it's important, is that I think it's actually important at the end of the day for the public. Every time I hear of a case of a naturopath taking somebody off thyroxine and putting them on B vitamins because they think B vitamins is for energy, or taking an epileptic kid off their anti-epileptic medication and giving them herbal medicines, or putting somebody on a water diet, or feeding somebody who's got end-stage renal disease, potassium broth. Those sorts of things indicate to me that the individuals doing that don't have appropriate educational qualifications. And at the end of the day, I think the public needs to know that if they go and see a naturopath, and our best estimation at the moment is that 10% of the Australian population sees a naturopath at least on an annual basis, then they need to know that the educational qualifications of the person that they're actually seeing has been vetted in some way as being appropriate for prime contact independent practice.
Thank you, Steve. There's a question over there, and can I just say two questions and then we'll finish up. Can I just quickly say that bone broth in renal disease, for example, that would also therefore extend to nutritionists, because I guess we want to make sure nutritionists are also at that level where you're guaranteed that that person knows what they're doing. You see that nutritionist, yeah?
My question is quite broad, and I thank you all for providing so much information and explaining the reasons why we do need to be registered. But from this point now, what can we as students, as practitioners, as educators, what can we, if anything, now do to make this happen, to help this process continue?
I think that's actually probably a question that we should throw to the whole panel.
Yeah.
To an extent, one of the things that I'd actually say is be patient. Because, as John said, politics tends to work at those two speeds, stop and tomorrow. The reality is that these things actually happen incrementally, and I'm fairly clear that the arrow is well pointed towards occupational regulation, and provided we make sure that the movers and shakers that represent our professional associations are saying the right things, then we can actually head in the right direction. When you graduate, join a RONA, join a professional association that believes in professional regulation. And if you really want to be engaged, start writing to the Health Minister and asking the Health Minister why naturopathy is not yet a professionally registered occupation in this country, given the fact that it was recommended to the Australian Health Ministers back in 2005.
So I guess I'd add two things to that. One is, I think, something that Stephen's already covered, which is just talk to each other. So that's a very, very simple, common sense approach, but the associations don't talk to each other. They very rarely work together, even today. The colleges very rarely talk to each other. Students in one college do not know the students or interact with the students in the other college. So, we need a cohesive community and actually develop a professional community, which I don't think we have in naturopathy at the moment. It's still very siloed in the same way. On top of that, I'd also say get involved. One of the big problems in naturopathy that is very different to all the other professions I've worked with, so osteopaths are very politically engaged, for example. The medical profession is incredibly politically engaged. Naturopaths tend to, we often expect so much of our associations, but associations are run by volunteers who are already overworked in many cases, and they would welcome your involvement to actually help them further the goals. So the associations can't work for you unless you help the associations to work for you. So become more politically involved. That, particularly young blood. I think the young students. This is your future, and I think your insights are particularly important.
Okay. I didn't know I was going to ask this. Thank you, Martin. I was very generous. So we're working here beautifully. I don't really know that I have too much more to add than that. I think that you young people here and the young students, and I recognise a lot of you, you really are the future, and I think if you do talk and you do advocate to decision makers as much as you can, it will happen, and it definitely will happen, because it will end up being on, you know, a health agenda again, and we'll finally get there. So, yeah, talk, communicate, advocate, jump up and down.
I think I'd just like to reiterate Stephen and John's point of stop giving your money to associations that actively oppose registration. You know, think about that. There's so many of us that are doing that, so many that have joined an association that lobbies the health department, that lobbies the education department for minimum standards, you know, lobbied against lobbied very hard against the bachelor degree as the minimum standard, and wanted the continuation of advanced diplomas, which just boggled my mind of this business. So, you know, in all honesty, you know, think about who you join, investigate the associations, find out what they stand for, what they represent, and as John said, get involved as well. I spent 8 years on the board of directors of the National Herbalist Association of Australia, not because of anything particularly special, just because my teacher told me to get involved, and I did. And you know, it was a great experience working with great people and actually doing something and helping the profession go forward. And it's something we can all potentially do. We can all contribute.
I don't think there's a whole lot that I could add, but I will just emphasize, get to know the issues really in depth yourself. So you've heard, some of you may have heard discussion about registration for the first time this evening. I've learned things from listening to some of the other speakers that I didn't know, being relatively new. Keep learning about the ins and outs of what this is about, and get really well versed so that you can actually discuss it, not only with your minister perhaps, but with each other. Because if you're discussing this with other students, it's the same thing as anything political. You may or may not change minds by talking about it, but you might plant a seed in somebody who had never even thought about this before. So having open discussion about it and really understanding the issues in such a way that you can discuss it openly is a very valuable thing, and it will lend itself to cohesion of the profession.
I do have just one quick thing to add, because I didn't think I was speaking before, but now I've thought something. Look, a really important thing as well is basically how you represent yourself in the community. So that you are, you know, I'm not just talking about evidence-based medicine here, but I'm talking about, you know, being responsible, being, you know, caring for your patients well, and representing the industry well. And I think when I talk to that, I think you know what I mean. Because what we don't want and what won't work for us as a profession, as you know, we talked before, many people without qualification, without appropriate qualifications, will call themselves a naturopath, for instance. So, and they may, you know, blog and start talking about all sorts of, you know, weird, wonderful things that are potentially, you know, beneficial, but not at all. And that sort of communication in the wider community doesn't do our profession any favours. So just be thoughtful about how you present us to the wider community, because that's really, really important, because, you know, any notion of quackery and any notion of, you know, purporting things that don't really make sense and are illogical and go against epidemiological evidence and blah, 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 is not going to do us any favours. So, yeah, that's the only extra thing I want to add. Thank you.
Yeah, that's a great point, Sandy. Not, you know, knowing what you're talking about and not perpetuating myths as a profession, you know, being solid in what we speak. And the association that Ian spoke about, the National Herbalist Association, is now, of course, called the Naturopathic Herbalist Association of Australia. What do you name?
Just changed a few days ago.
Naturopaths and Nutritionists.
No, Naturopath and Herbalist Association of Australia. Excellent. So, and we've got a question at the back. Thank you. Pass it out, please. Thank you.
So, my question was just regarding, I've heard a lot of people talk about political footing and how other industries possibly have more of a political stance than we do. In the last federal election, I guess we were somewhat represented by the HAP party. How important is it for us to get behind a political party like that who's going to lobby for us and possibly help us register on a national level as opposed to the states?
Well, I have a actually spoken with a couple of colleagues about, because I was very disappointed with what happened in the last federal election with the Australia Party and the perception of them being anti-vaccine, and we've heard people say, how could they be a health party if they're anti-vaccine? Well, that doesn't make much sense, because that's what a lot of people think. I'm going to be speaking about vaccines in just a minute when I'm introducing the next public forum. You know, the biggest, in politics, the biggest rule is that you can't make a mistake, don't make mistakes, and to be caught on a polarising issue, like being seen as anti-vaccine, obviously devastated the Health Australia Party, or HAP, and they didn't do very well in New South Wales, even though they had the first place on the Senate ticket. Didn't really make any difference compared to other states. They got a couple, 0.2% more compared to other states. So I've been speaking with a colleague of mine, and we're looking at starting another political party called, in relation to preventive health party, or something along those lines, which is actually pro-vaccinations and immunisations that are safe and effective, but also beyond that as well in terms of preventative health. Because if you ask the GP what's preventative health, the GP will say vaccinations pretty much, and it's quite superficial and reductionist. There's so much more, of course. There's the full approach in terms of prevention, diet, lifestyle, nutrient deficiencies, and everything else that we do holistically, like I mentioned at the start. And that's real prevention, is to look at the big picture, the whole picture. And that's something that I'm very interested in, the political side of it. The other side of it is another big way to make change politically is to get involved in a party that you like, you can become a member, and you can do internal lobbying. And that's the way political parties come up with their policies, is to say, well, you lobby within the branches of that party, and that the branch approves that position, and then they take that to the annual, their conference that they have, usually every second year, and they vote on it, and if the branches have approved it, it gets passed as their new policy. So that's another way to make change, to be aware of. So that's it.
I'd just like to make a comment, I guess, on the role of political parties in promoting professions. The Health Australia Party does not promote the profession. The professional associations are supposed to promote the profession. So you should not be throwing your weight behind political parties, because parties change, governments change, and you need an association that's reflexive and flexible to actually promote your interests no matter who's in power. So by aligning yourself with one political party or the other, you're basically inviting yourself for the other political parties to ignore you. So I would really strongly urge to be political, support your professional associations, because that's their role. They're not supposed to be pseudo-regulators, they're supposed to be advocates for your profession. The AMA is one of the most politically powerful associations on the planet, both in Australia and, the two AMAs, maybe not the planet in terms of, but it's one of the most powerful political organisations of any sort in Australia. The Pharmacy Guild, equally so. These are, the medical profession doesn't have a political party, it has very, very, very strong associations. Even though the AMA actually represents less than 20% of medical practitioners, incredibly powerful.
Running other times, anyone really want to say something? So that wraps it up, guys. Unfortunately, we've got a few more questions. It's great to see. We've got a great turnout tonight. We've got about 75 people, which is a significant improvement from last time, and that's excellent. There's going to be a bit of mingling time as well, right after this, for us to mingle and know each other in the community, Naturopathic and Nutritionist community. Just want to point out that the next topic that I'm going to be looking at doing a public forum on, which is to clarify a few of these issues, a few of these debates around vaccination. So, as you will have worked out, I'm in favour of vaccinations when they're safe and effective. We're talking about immunisations, medical vaccinations here. There'll be various views on that, of course, but I think the bigger issue is the vaccination schedule, which is where a baby gets at birth 250,000 nanograms of aluminium hydroxide in a Hep B shot that goes intramuscular, giving a huge absorption into the body. And then if you compare that to 20 to 50 nanograms that might be in a bit of breast milk, or in breast milk for that baby. You know, that huge hit, 250,000 is something that's baby is going to be really struggling to metabolize and detoxify right from the first few minutes of life. So should that be there at birth, or can that wait until maybe year 7 when the person's only going to need a Hep B shot from that point on in their life, most likely? And then other elements to the vaccine schedule is something that I want to discuss, get a panel of people to talk about. It's such a polarising issue, and I think that it would do our profession well to have perhaps some clarity and maybe some agreement on it as well. And so I'll be organising something along those lines next year. So this is the end now of the forum. Thank you guys. We've gone over time, but it's so engaging. We'll get going with more questions. So thanks so much.